With the reports indicating a drop in the number of HIV infections over the past 1 decade, it is now emerging that the triple threat of new HIV infections, adolescent pregnancies, and gender-based violence is threatening the realization of sustainable development goals. It is a move that has drawn the attention of both the government and non-government organizations. The National Syndemic Disease Control Council, for instance, has expressed its worry about the bulging number of infections, especially among adolescents.
For new HIV infections, we have about 99 adolescents and young people getting new HIV infections every week. And you can imagine when that is happening, that also brings in aspects of sexual gender-based violence.
And that the numbers will put pressure on the already burdened health sector.
When one gets HIV, they have to live with it the entire life, meaning that even for our healthcare system, it has to be in such a way that it supports this person until they are old enough or they even get to their 70s, and it's a huge burden to this country.
According to IREP, an NGO, there is need to work on modalities to end further transmission and decriminalize HIV.
But still there is a gap in terms of misinformation and a lack of comprehensive sexual education, and therefore there is stigma, and also there is the aspect of HIV criminalization. People would want that if they maybe have been affected or infected by a persons of HIV, that they be implicated where they might think or they might have reasons to believe that the person knowingly infected them.
The effects of stigma have seen many patients like Rose Mwelu face unending stigma since coming out as positive back in 2012. For her, life has never been the same again as she was criminalized.
Hapo nilijikubali. Nikaambiwa hata niwe na set alarm ya dawa. Isipokuwa juzi last month 20th nilienda hospitali akaniambia Rosie uko na stress. Unavuka dawa, nikaambia daktari alarm ipo. Hata mtoto wangu akikuja hapa atawaambia. Ania basi imeinuka kidogo na ni sababu ya stress. Nafikiria nini? Nikamwambia tu nafikiria watoto wangu na sana hiyo nimekaa muda bila kumuona.
She even contemplated suicide only to realize her purpose in life and resorted to taking ARVs, at least for now.
Mwenye alinipeleka hospitali wakati nilikuwa mgonjwa ndiye alikuja. Kaniambia hata akikataa kuja acha tupeleke mtoto hospitali. Tupeleka mtoto hospitali. Baada ya mwezi mmoja alipona. Na vile nilizaa mtoto ni Mungu tu. Alita negative, nilikuwa nataka tukufe tu. Ikiwezekana nikiwa ndo hiyo mkubwa tupate ajali tuangamie.
According to IREP, the government should direct its efforts in enhancing the U=U program to help patients like Rose from further infecting others.
The society, we are supposed to educate our society and our communities to understand that HIV is not a killer disease, and for them to embrace each and every person living with HIV, and just letting them know that HIV does not define anyone. It does not even, it is not their identity.
Anti-HIV campaigners insist that apart from fighting against stigma, there is need for concerted efforts by both governments and partners if eradication of the triple threat is to be achieved.
U2U program, it's about ensuring adherence and having undetectable viral load. And what we know from science is that when the virus levels is low, the probability of transmitting it during sexual intercourse is also low.
Reporting for K24 TV, I am Electine Odera.